As human beings, our health and the health of those we care about is a matter of daily concern. Regardless of our age, gender, socioeconomic or ethnic background, we consider our health to be our most basic and essential asset. Ill health, on the other hand, can keep us from going to school or to work, from attending to our family responsibilities, or from participating fully in the activities of our community. My friends, those words are taken from a joint document prepared by the Office of the United Nations High Commissioner for Human Rights and the World Health Organization. In that document, they confirm that health care is a human right. My friends, as we get closer to Election Day, I want you to take a very good look on the resume, qualifications, experience, and track record of persons that are putting themselves forward to serve in our Parliament. Why? Because competency matters. The members of Parliament have a responsibility of ensuring that the interests of the Caymanian public are always protected. This system, while simply designed, is complex in its day-to-day operations. The affairs of our country cannot be solved in a soundbite or a tweet. It requires careful analysis and deliberations to ensure that the best decisions are made on behalf of the Caymanian people. After all, our job is to make your life better. We do this by passing laws and regulations that are driven by policy. It is therefore important that the people that are deciding policy in our country are competent. Equally, the people that are carrying out these policies must also be competent, and the people enforcing our laws and regulations must also be competent. Again, competency matters. I raised this issue as there was an incident that happened early on in my term that I want to touch on today. By law, ministries, statutory authorities, government companies, commissions, etc. are required to prepare annual reports. These reports are tabled in the Legislative Assembly and in doing so becomes available to the public. I recall one year where the annual report for CIMA was tabled, and in reviewing the report, I noticed that the total profit for domestic insurance companies was just under $125 million. Naturally, I looked at the healthcare column and noticed that just over 14 million of the 125 million in profit was related to healthcare. Now, those numbers by itself meant nothing to me. I had no point of reference. Was this good? Was this bad? Or did it compare to prior years? So, I went looking at the prior year numbers, and that is when it happened. The profits for the previous year, 2015, was over $180 million, with healthcare accounting for $51.5 million in profit. For 2014, the profits were $166 million, with healthcare accounting for $14 million of that profit. In short, 2014 and 2016 looked normal, but 2015 didn't. That $51.5 million in profit kept me up for several nights, trying to figure out what happened. I spoke to the Minister of Health about it. He had no idea. So I kept digging and digging. I went looking at the annual reports of the HSA. I noticed that there was a prior period adjustment around the same time of more than $100 million, and that the losses at the HSA in 2015 and 2016 was in the tens of millions. My friends, it was an unsettling time for me. How can the HSA be losing tens of millions and the health insurance industry making tens of millions? I couldn't find the answer. So I went to see my colleague, Ard McLean, and we both discussed it with the man with the most feared windshield in all of Cayman, Ezra Miller from Northside. Ezra said, "Son, this is why we have a public accounts committee. Let's discuss this at the next PSC meeting to see if we could have a public hearing to get to the bottom of this." True to his word, Mr. Miller did. Representatives from CIMA, the Health Insurance Commission, and the Ministry of Health came before the Public Accounts Committee. Still, couldn't get an answer. The media and the public picked up on it, and now more people wanted to know what happened. It turns out that the reason for the increase was the results from international businesses was included in domestic results. My friends, the point I want to make is this. We have safeguards and checks and balances in our system to ensure that the public interest is protected at all times. The Ministry of Health should have picked up on that issue. They didn't. The Health Insurance Commission should have picked up on that issue. They didn't. This is why competency matters. This country needs competent people that will stand up and not blindly follow other people. This country needs people that will challenge the premiering cabinet like Marco and Wayne did. This country needs people that will challenge the political decisions like the CPR group did. This country needs competent people. My friends, think about this. The cabinet has a responsibility to appoint members to government boards and commissions. But it is also important that they give these boards and commissions the proper tool to get their job done. They need the proper resources to analyze these complex industries. How is it that successive governments and the Health Insurance Commission allowed health insurance premiums to increase by over 400% in almost 20 years, but the fees that the doctors and healthcare providers can charge insurance companies have not gone up in almost 20 years? What is driving the increase in the healthcare premiums? The answer: competency matters. We need competent people to appoint competent people to serve on these boards and commissions. My friends, healthcare is a human right. Too many of our older Caymanians are being discriminated in the workplace because their health insurance premiums are too high. Our people are living longer. Our people in their 50s, 60s, 70s, and even 80s are still productive. We can no longer live in a society where they are being pushed out or forced out because of high insurance premium. It is time for us to move to universal health care. Again, I remind you, elections have consequences. Competency matters. Have a safe Easter. God bless.